Good afternoon, everyone. Today's our briefing for December 30th, 2020. It is our last update from a media press update and community update of the year. We've, I think, had over 60 of these updates all throughout the last months since the pandemic started. Probably have answered hundreds of questions here, and we'll continue doing this into 2021 as long as there is critical information to share. And it's important, of course, that there's always an opportunity to ask questions and to get information out as much as possible. So I want to thank you for being so supportive in this last year. It's been a very tough year. We also have a lot to go over today, so I want to begin right away. The first thing I want to mention is we've now lost 391 Long Beach residents to COVID-19. We're going to hit that 400 number, unfortunately, over the course of the next few days. And that is a significant number of folks that we've lost in our community throughout this year, the single biggest loss of life. And it's just a reminder that the impacts that we're seeing today are directly related to Thanksgiving, the high death count, related to folks gathering in groups in their homes. And this is the same that we're bracing for around Christmas. The impacts from Christmas we won't see until mid to late January. And so we're just hoping for the best, but please, we have one more opportunity to do the right thing as it relates to holidays. And tomorrow, as we celebrate New Year's Eve and the New Year, please stay at home and gather with the people in your household. That's what me and my husband will be doing, and we encourage everyone to do, please, the same thing. I want to begin by just talking about something that we don't normally get to, but it's really important because I'm getting a lot of questions about it, and I hope that the media and others also pick this up as something that's really, really important. So as an example, yesterday we did over 5,000 tests at our testing center. I remember many months ago standing up here when we got to 1,000 tests. And we would, we're proud of that at the time, and now we're doing over 5,000. We're doing thousands and thousands of tests every single day. And we have been since the testing started back in the spring of earlier this year. What people may not always know, and I find when we talk to folks, there's something that they oftentimes didn't know, is that these testing sites are staffed by our city team. And so the folks that are out there doing the tests every single day at multiple sites across the city are health officers, there's clerks, they're lifeguards, they're city employees from multiple departments, they're from all across the organization. And so what we've had to transition to as a city is we've had to essentially recreate ourselves as this massive medical and testing operation during the length of this pandemic. And so the folks you see out there on the front line doing these 5,000 tests that they did yesterday, those are folks that a year ago, some could have been at a desk helping you out at one of our departments, or it could have been a lifeguard that was out saving people on the water. We've had to consolidate folks and do that level of testing. Why that's important is I'm often asked, hey, I think city services might be slower, or I see more trash outside, or I see folks experiencing homelessness who need support immediately. And I've not seen the same level of city service as maybe I have in the past. Well, that's all true because you are not seeing the same level of city service that we've had in the past. The city system and the organization has reduced because we've had to move so many resources onto the testing sites. That is number one. We've also had to redirect enormous amounts of our operation and organization to COVID-19 response, to communication, to ensuring that we are working with businesses on grants, or we're focused on the other types of parts of the organization as it relates to vaccine distribution and planning and public safety that has shifted what we can do. Another example is let's take our street sweeping and cleaning maintenance. Those, on any given day, we're down about 25% capacity that we normally would be. Why? Because folks are quarantined, or they might be sick, or they might have a family member they need to take care of. And so not only have we moved an enormous amount of resources into testing and vaccination now, we also are seeing very high levels of folks that are not able to do the work for being sick or for having to quarantine, and because of the enormous impacts to budgets. We know that, of course, furloughs also happen every other week for certain employees. And so all of that together puts us in a position where the same level of service that we were used to pre-COVID is not in place today. And I just want people to know that, one, to be patient. Second, to know that people are working so hard to still deliver these services that even though paramedic service, that we have more calls for service today for our paramedics because of COVID-19 than ever before, that people are stretched thin, that most folks have worked without a vacation for many, many months, that we are still delivering basic core services on top of this pandemic as we need to be. And as vaccination and this crisis hopefully begins to recede in this first part of the year, we can expect that we are also going to be back to a more full service operation. Because I, like you, don't like seeing some of our services reduced. The situation has also changed our patterns. I had a friend and a neighbor ask me, hey, it just seems like some of our trash operations have shifted. I said, that's true. I said, one, because folks are out. And two, is because as a city, we are producing way more trash. And so residential trash pickup has increased because folks are at home. And so when you add the amount of trash that we're producing in our neighborhoods, the decrease of folks, and the issues around switching to testing, you really see that this is a hard challenge, but one that I think our team is doing an excellent job. And so to every single member of the City of Long Beach team, I just want to thank you for your hard work in 2020. 2021 is going to be a better year, and we're just grateful to every single one of them. So I wanted to make sure that residents understood why certain services are being impacted and why they see a difference. And now I want to also just turn to some developments as it relates to COVID-19. You probably note that yesterday the governor extended the safer at home, stay-at-home orders here in Southern California. Our ICU capacity essentially is full all across Southern California. We have very little capacity in not just Long Beach hospitals, but hospitals across the region. And it's important to note that we don't know when this extended stay-at-home order will be lifted. It's really all dependent on how we're doing and how hospital capacity is doing. We also know that the governor announced today that this additional different strain of COVID, which is now has been seen in Colorado. It was out actually in the UK, and now it's also here in California. Is something our health department is aware of, and they are talking to the county about this strain. While it doesn't appear yet that the strain has an impact on mortality or on symptoms, it is essentially something that transmits in a way that is stronger and actually is much more transmissible between folks. So he's a little bit more powerful. And there's a lot to learn about it still. We hope to have more information to share in the days and weeks ahead. I also want to share a little bit about our vaccine rollout, and it's some good news, I think. The first is that we expect to be done with all of Group A by January the 10th. And so if you remember, Group A was all of our hospitals, our clinics, our medical centers, our pharmacies, our paramedic units, our healthcare workers, essentially all the medical piece has, as you know, started. People are getting vaccinated every single day at our hospitals. Right now, our nursing care facilities are getting vaccinated, the residents and the workers, which is part of Group A. We expect all of our paramedics to be receiving their vaccinations starting next week, along with those that are within, of course, part of the fire department that are paramedics and EMTs. And so we expect to be done with Group A by January 10th. At least that's the goal. Starting January the 11th, we're going to begin what we've called Group B, which we've talked about in the past. And Group B is essential workers. And that Group B list is large, but as a reminder, folks that are in that group are going to be teachers and educators, essential frontline workers like grocery clerks and food distribution, as well as critical city services, police officers. You'll have folks that are working with people experiencing homelessness and those that are having close contacts. And so all of that group and that group B will begin there on January the 11th, at least that's the target date, and will take weeks to finish because it's a very large group. And then, of course, once that group is done, then we move on to Group C, which includes essentially many of our seniors and other folks that might have critical conditions. So that's the plan laid out by the state that we are following and that we're also partnering with. And so I just want to let people know that we are feeling very good about our local vaccination process. Already here in Long Beach, we have been allocated and received about 22,000 doses so far. And so those are being spread out and put out across the city. And as a reminder, we have partnered in Long Beach, as has most of the state, with our local pharmacies like CVS and Rite Aid, and they're providing direct vaccinations to nursing and skilled care facilities, and they're doing a great job. That's already been rolled out. And just to close, before I turn this over, and Dr. Davis is on the line, and she's going to say a few remarks and answer some questions. I just want to remind us that our doctors and nurses are in a really tough spot right now. I continue to talk to our hospital leadership and nurses and others, it feels like daily, and they are really asking for our help. Next few days, next few weeks are going to be important to not overwhelm them. They are working without breaks. They're working and they're tired, and they're seeing more and more patients every day in our hospitals. And so if you have compassion and care about the folks working at St. Mary and at Memorial and at college and all these places in our community, let's respect them and try to stay as safe as possible in the weeks ahead. And so with that, I'm going to turn this over to Dr. Davis. She'll also be able to take any questions, as will I if there are any.
Thank you, Mayor Garcia. Good afternoon. So today I'll talk about hospitalizations, but first I'm going to answer a few common questions about the COVID-19 vaccine. Vaccines play an important role in keeping us healthy. They protect us from serious and sometimes deadly diseases by preparing our body's immune system to recognize germs and fight off infection. Stopping this pandemic requires using a combination of all the tools that we know and strategies that we know work. And together, COVID-19 vaccination and following public health recommendations to prevent the spread of COVID-19, such as wearing a face covering and practicing physical distancing, offer us the best protection against infection, illness, and severe disease. The COVID-19 vaccination can't cause COVID. The vaccines protect us from the virus that causes COVID-19. After vaccination, if you're exposed to the virus, meaning you come into contact with someone who has COVID-19, your immune system will be able to help you fight off infection. You'll need a total of 2 doses of the COVID-19 vaccine. In order to get the most protection from the vaccine, you'll need a second shot 3 to 4 weeks after your first shot. And it usually takes a few weeks after the second shot for a person to be fully protected. If you miss the date of your second shot, you can still return at a later date to get it. You will not have to start all over again. The COVID-19 vaccines can cause fatigue or tiredness, headache, fever, and muscle and joint pain. These are actually signs that your body is making an immune response. Symptoms should not last for more than 1 or 2 days. People who have gotten sick with COVID-19 in the past may still benefit from getting the vaccine. Those who are actively infected should not receive the vaccine. However, once your isolation is completed and you're completely recovered, it's recommended that you get vaccinated because of the severe health risks that COVID-19 can cause. And sometimes someone who has had COVID before can get it again. I want to remind you that the COVID-19 vaccine is for all of us. When you choose to get vaccinated, you aren't just protecting yourself, but also everyone around you. Now I'll turn and take a few minutes to talk about hospitalizations and the impact of the current surge in cases on our hospital and healthcare system. With record-breaking cases, deaths, and hospitalizations each day, health systems throughout the region are overwhelmed. As of today, 207 Long Beach residents are hospitalized with COVID-19, and a total of 504 people with COVID-19 are hospitalized in the Long Beach area hospitals. Hospitals continue to be impacted in ways that affect all of us. At hospitals right now, there are longer waits in emergency rooms. Facilities are having to use spaces for patients that weren't designed for them. Staff are working extended hours, having to pick up additional shifts to carry the load. And they're using supplies up more quickly than usual. These facilities are having to adapt in ways they haven't had to before. We don't want to see things get worse, what's described as crisis care, where hospitals have to severely triage medical care or ration limited supplies. We're in the middle of a surge, and healthcare providers are being pushed to their limits. Having an additional surge would push our healthcare system even further. The orders established by the state and us locally were put into place to protect the health of our residents while trying to get us back to our normal lives. In putting these orders in place, we've had to make some very tough decisions. And this means that our residents and businesses have had to make many sacrifices throughout the year. Yesterday, we issued a message in coordination with the health jurisdictions and the Public Health Alliance of Southern California. Our message is simple. We need everyone to follow effective, fact-based public health measures to stop this surge in cases and get us back to a point where we can ease restrictions. We need everyone to adhere to the Safer at Home health order, to wear face coverings, to wash our hands, to practice physical distancing, and to stay home except as necessary to conduct essential activities, which is critical over the remaining part of this holiday season. We all have a personal and collective responsibility to slow the spread of the pandemic and eliminate this virus. This is something I know we can do. As we've indicated, people are starting to get vaccinated, and we will soon see the benefits of vaccines. But in the meantime, we can't be complacent, especially now with the virus spreading throughout the region and the state. It's more important than ever. Thank you for doing your part. Thank you for adjusting this holiday season, for sacrificing, for staying home for New Year's, for celebrating in new and different ways. Your decision to do this can potentially keep someone you know or someone you don't know from becoming severely ill from this disease, or from keeping someone out of the hospital, which eases the burden and makes it possible for others to get the care and treatment they need. Thank you for all that you're doing to fight COVID in Long Beach.
And now we're going to take some questions from the media. Our first question is from Kelly with the Long Beach Post. Kelly, go ahead with your question, and could you let us know who you would like to address it to, the mayor or Dr. Davis?
Yes, this question is for the mayor. Hi, Mayor. I just think it's important to note about the city services being impacted. Could you just provide a little bit more detail on which services we're really seeing a difference in, so we could residents know what to expect with some maybe specific types of services?
Yeah, I mean, I think it's a lot of city services are being impacted. I mean, some directly, and then some indirectly. So one example will be, let's say, just paramedic service. So we know with certainty that response times, as far as the amount of calls that are being made, that people need paramedic service have increased dramatically. And so I can certainly send you what those exact numbers are, but so we know that there's increased paramedic service, and so that's going to impact directly how folks have access to having an ambulance there when they need it, and the response time. And so that is one way that COVID's impacting a service. So I might not have anything to do with COVID, but if I have a heart attack, I want to make sure that there is a unit immediately at my home. Because of the strain on the paramedic system, that's having an impact for non-COVID related paramedics services. Let's take trash. We know that right now homes are producing more trash, maybe 12 to 15% more trash on average than outside of COVID. That, when you take that amount of trash and you multiply that across the city, that is an enormous amount of additional waste that the city is now having to pick up from homes, whereas normally that waste may have been picked up by other haulers at other businesses or other locations. And so that has an impact on the trash collection system. And the biggest impact is the loss of just people and their time. There's not a day that goes by in the city where we don't have people that call out sick that because of something to do with a quarantine issue or a COVID-related issue or a childcare issue because of COVID-19. And this happens on some days pretty significantly. And so you might notice we have clean teams across the city. Well, clean teams have been reduced, not just because we have people that are sick or they're not fully staffed, but we also have clean teams that are partnerships, for example, with the court system, where you have folks that we're trying to divert out of the correction system and maybe get into community service. Those programs aren't in operation, and so that also is another diversion. But the biggest impact that people should be able to see is at the testing centers. They should know that every time they go to get a test, all those folks that are there, a lot of them that's not their job. And a lot of them are another part of the city that right now they're not able to work on. And please know that I think there's an assumption that all those workers are somehow healthcare workers or health department workers. And a lot of them are, but the health department has to still function outside of COVID. Just because COVID-19 is happening, it doesn't mean that the health department isn't working on all the other things the health department would normally work on any given year, and all the other diseases or health needs that still exist. So those are some examples, and we can certainly get some more data points if you're interested, we can send over.
Thank you, Mayor. Thank you, Kelly. That concludes our press conference for today. We will now move to Spanish translation.
Muy buenas tardes, gracias por acompañarnos. Hoy es nuestro comunicado de prensa para el 30 de diciembre del 2020. Este será nuestro último del año y continuaremos con más comunicados el próximo año. Vamos a empezar con datos generales. A la fecha, más de 31,000 residentes de Long Beach ha dado positivo por COVID-19. Tan solo desde ayer tenemos un aumento de 600 casos y lamentablemente hemos perdido 391 residentes en la ciudad de Long Beach a causa de COVID-19 y también tenemos que informar que desafortunadamente alcanzaremos los 400 en los próximos días debido a la cantidad de personas que están en el hospital en cuidados intensivos. Esto es informando 11 nuevas muertes desde ayer. Actualmente estamos sintiendo los efectos de las reuniones del fin de semana de Acción de Gracias y es fundamental que nos quedemos en casa este fin de semana de Año Nuevo y busquemos formas alternativas de celebrar de forma segura. Recordemos que tarda varias semanas para ver esos impactos de las reuniones en los hospitales. Entonces sabemos que las reuniones que se hicieron el fin de semana de Navidad los veremos en enero en los hospitales. Necesitamos proteger a nuestros seres queridos y hacer nuestra parte para reducir la propagación y la transmisión del virus. Muchas personas que tienen el virus no saben y más del 50% de esas personas no presentan síntomas. Entonces, por favor, tomen en cuenta que aunque usted vea a una persona, usted no sabe si lo tenga o no, porque una de cada 2 personas podrá tenerlo y no tiene síntomas. Una cosa que el alcalde mencionó que también quiero detallar a todos ustedes es que ayer se hicieron más de 5,000 pruebas de COVID-19 alrededor de la ciudad, en los diferentes locales de prueba que tenemos aquí. Y queremos mencionar que esos lugares, cada uno que es administrado por la ciudad, tiene personal de la ciudad que anteriormente no trabajaba en salud. Tenemos personas que quizás eran salvavidas el año pasado o secretarias o trabajaban en otra división o departamento aquí en la ciudad y ahora están trabajando para poder ofrecer estas pruebas diariamente. Cada una de esas personas que usted ve trabajando en un sitio de prueba es una persona menos en el local o en la silla donde ellos anteriormente trabajaban. Entonces queremos recordarles que cuando usted quiera llamar a la ciudad por un servicio de basura o cualquier otra cosa, va a tardar un poco más para poder contestar sus llamadas y ofrecerle ese servicio. Normalmente, ahorita estaba mencionando el alcalde que aproximadamente el 25% del personal que trabaja limpiando nuestra ciudad cada día está de falta en el trabajo por cuestiones de COVID-19, por cuarentena, quizás cuidado infantil o cuidando de una persona enferma. También muchos de ustedes también sabrán que la ciudad tiene servicios limitados cada 15 días, ya que también los empleados tuvieron que tomar una pérdida de sueldo, un furlough. La basura residencial también ha incrementado bastante ahora que muchos de nuestros residentes están trabajando de casa. Dice el alcalde que quizá un 15% más de basura por cada hogar, pero si multiplicamos eso, el 15% por cada casa que vemos aquí en la ciudad de Long Beach, puede imaginarse la cantidad de basura que normalmente quizás se recogería por otros servicios o quizás se tiraría en el trabajo o en otra ciudad donde los residentes normalmente trabajan. Así es que cada vez que usted vaya a hacerse la prueba, tome en cuenta la cantidad de personas que están dando ese servicio y por eso mismo otros departamentos y divisiones en nuestra ciudad están impactados. Ayer, como se esperaba, el Estado extendió la orden regional de quedarse en casa aquí en el sur de California. El Estado tiene una capacidad de cuidados intensivos de 0% en todo el Estado, al igual que aquí en la región del sur de California y el condado de Los Ángeles. También queremos mencionar que el Departamento de Salud sabe del nuevo tipo de COVID que se ha mencionado en Colorado y también identificado ahora aquí en California. Se dice que es más fuerte y se transmite más fácilmente. De todos modos, vamos a monitorear esa situación. Como he mencionado anteriormente, la ciudad de Long Beach tiene su propio departamento de salud y también con la ciudad de Pasadena dentro del condado de Los Ángeles. Ahora vamos a hablar sobre la vacuna de COVID-19. Las vacunas se autorizaron para uso de emergencia porque no hubo problemas graves durante los ensayos clínicos. Hace un par de semanas comenzamos a administrar la vacuna de COVID-19 a personal de nuestros hospitales aquí en la ciudad de Long Beach. Hasta ahora hemos podido administrar más de 5,500 vacunas, es decir, el 60% de los trabajadores de salud en nuestros hospitales. Estas son buenas noticias, pero aún hay mucho más que recorrer hasta que la vacuna esté ampliamente disponible para todos los residentes en la ciudad. Hasta el momento se han asignado 21,800 dosis de vacuna aquí en la ciudad de Long Beach. También se mencionó que un nuevo programa federal lanzado esta semana mediante el cual las farmacias aquí de la ciudad han recibido vacunas para ser administradas en centros de atención a largo plazo aquí en la ciudad de Long Beach. Y me complace confirmar que las vacunas comenzaron en centros de atención a largo plazo esta semana. Como recuerdan que al principio de esta pandemia, esos centros de atención a largo plazo eran los que tenían normalmente la mayoría de los los casos de COVID. Todos nuestros centros de enfermería especializada están inscritos en este programa, así como algunos de nuestros centros de vida asistida, centros de atención residencial, centros de cuidados intermedios y viviendas del programa HUD. En esta asociación, el gobierno federal y los CDC llevan las vacunas a las farmacias y las farmacias entonces proporcionan las vacunas a las instalaciones, tanto para los residentes como también al personal que trabaja ahí. Una vez que se complete ese nivel 1A, se espera que las vacunas estén disponibles la semana del 11 de enero para aquellos en el nivel 1B. Mencionó el alcalde que la meta es terminar con todo el grupo 1A para el 10 de enero, unas cuantas semanas. Y la 1B incluirá personas que trabajan con el público, como la policía, aquellos en educación, trabajadores del sector alimentario y los trabajadores de recolección de residuos. Esas son buenas noticias porque necesitamos que las personas en el nivel 1B estén saludables para mantener esos servicios esenciales que anteriormente he mencionado que han sido afectados por personal que ha sido movido a trabajar a sitios de prueba o que están faltando al trabajo por razones de COVID. El grupo 1C va a incluir a personas de tercera edad. Pasará un tiempo antes de que la vacuna esté disponible para el público en general y lleguemos a lo que se conoce como inmunidad colectiva, un punto en el que se vacunan y desarrollan inmunidad suficientes personas para proteger a quienes no pueden recibir la vacuna. Quizás alguien que tenga una alergia a algo que no puede tomar la vacuna, por lo que debemos seguir tomando precauciones mientras trabajamos para que cada vez más personas tengan esa vacuna. Hoy nos acompañó la doctora Davis, oficial de salud de la ciudad, que compartió respuestas a preguntas comunes sobre la vacuna de COVID-19. Aquí les voy a ofrecer algunas de las respuestas que ha dado la doctora Davis. Las vacunas juegan un papel importante para mantenernos saludables, por lo cual es necesario. Nos protegen de enfermedades graves y a veces mortales al preparar el sistema inmunológico de nuestro cuerpo para reconocer los gérmenes y combatir las infecciones. Para detener esta pandemia es necesario utilizar una combinación de todas las herramientas y estrategias que sabemos que funcionan, las vacunas y también seguir con cosas como la máscara, lavarse las manos, mantenerse a distancia. Juntos, la vacunación contra COVID-19 y esas recomendaciones que acabo de mencionar pueden prevenir la propagación de COVID-19. La vacuna COVID-19 no puede causar el COVID. Entonces, muchas personas creen que si se le dan la vacuna, le va a pegar COVID. Así no es como funciona. Entonces, la vacuna no les va a dar COVID, sino nos va a proteger del virus que causa COVID-19. Después de la vacunación, si está expuesto al virus, lo que significa que entra en contacto con alguien que tiene COVID-19, su sistema podrá ayudarlo a combatir esa infección. Necesitará un total de 2 dosis de la vacuna COVID-19. Para obtener la mayor protección de la vacuna, va a necesitar una segunda inyección a 3 a 4 semanas después de la primera. Acuérdense que mencioné anteriormente, dependiendo si toman la vacuna Pfizer o la vacuna Moderna, si va a tomar la vacuna de 3 a 4 semanas después para su segunda vacuna. Por lo general, pasan algunas semanas después de la segunda inyección para que una persona esté completamente protegida de COVID-19. Si pierde la fecha de su segunda inyección, aún puede regresar en una fecha posterior para recibirla. No tendrá que empezar de nuevo. Las vacunas COVID-19 pueden causar fatiga o cansancio, dolor de cabeza, fiebre y dolores musculares y articulares. Estos son signos de que su cuerpo está produciendo una respuesta inmune. Los síntomas no deben durar más de 1 o 2 días. Las personas que se han infectado con COVID-19 aún pueden beneficiarse de recibir la vacuna, y aquellos que están activamente enfermos o infectados no deben de recibir la vacuna. Espere hasta que pase su tiempo y puede después tomar la vacuna. Quiero recordar también que la vacuna COVID-19 es para todos. Cuando elige vacunarse, no solo se va a ayudar a protegerse a sí mismo, sino también a aquellos que lo rodean, especialmente a aquellos más vulnerables. Ahora vamos a hablar sobre las hospitalizaciones y el impacto del aumento actual de casos en nuestro sistema de salud. Como hemos mencionado la semana pasada, los números están cada vez más altos y con casos, muertes y hospitalizaciones récord cada día. Los sistemas de salud en toda la región están impactados, abrumados. Hasta el día de hoy, 207 residentes de Long Beach están hospitalizados con COVID-19 y un total de 504 personas con COVID-19 están hospitalizados en hospitales aquí en la ciudad de Long Beach. Recuerde que quizás personas de otra ciudad fuera de Long Beach vengan aquí a nuestra ciudad a recibir tratamiento, donde tenemos un total de 504 personas en el hospital, y de esos 207 son residentes aquí de Long Beach. Los hospitales continúan viéndose afectados de forma que nos afecta a todos. Recuerden que esas camillas en los hospitales, especialmente en cuidados intensivos, no solo son para personas con COVID-19, sino también otras personas que tengan problemas de salud, emergencias como un infarto. Hay esperas ahorita más largas en las salas de emergencia. Las instalaciones tienen que usar espacios para pacientes que no fueron diseñados para ellos. El personal ahorita está trabajando en horarios extendidos y tienen que realizar turnos adicionales para llevar la carga. Están demasiado cansados también de estar trabajando esas largas horas y consumiendo los suministros más rápido de lo habitual. Estas instalaciones tienen que adaptarse de forma que no tienen anteriormente. No queremos que las cosas empeoren, lo que se describe como atención de crisis, donde los hospitales tienen que clasificar severamente la atención médica, decidir a quién van a darle esos servicios o racionar los suministros. Estamos en medio de un aumento repentino y los proveedores de atención médica están siendo empujados a su límite. Tener un aumento adicional impulsará aún más nuestro sistema de atención médica. Las órdenes establecidas por el Estado y nosotros aquí al nivel local se implementaron para proteger la salud de ustedes, nuestros residentes, mientras intentamos volver a nuestra vida normal. Al implementar esos pedidos, hemos tenido que tomar algunas decisiones muy difíciles, lo cual ha afectado a nuestros residentes y negocios que han tenido que sacrificar a lo largo del año. Ayer emitimos un mensaje en coordinación con la salud de la Alianza de Salud Pública del Sur de California y nuestro mensaje es simple y claro. Necesitamos que todas sigan medidas de salud pública efectivas y basadas en hechos para detener este aumento de casos y llevarnos de regreso a un punto en el que podemos aliviar las restricciones. Estos siguen: cumplir la orden de salud, más seguro en casa, use cubiertas faciales, lávese las manos, practique el distanciamiento físico. Otra vez les pedimos que se quede en casa, excepto cuando sea necesario para actividades esenciales. Todos tenemos la responsabilidad personal y colectiva de frenar la propagación de esta pandemia y eliminar este virus. Esto es algo que se puede hacer y, como hemos indicado, la gente está empezando a vacunarse y pronto veremos los beneficios de las vacunas. Por lo tanto, vamos a pedir que todos sigan esas reglas y no seguir con la propagación del virus por toda la región y todo el estado. Gracias por hacer su parte, por ajustar esta temporada navideña, por sacrificarse, por quedarse en casa en Año Nuevo y para celebrar de formas nuevas y diferentes. Su decisión de hacer esto puede potencialmente evitar que alguien que conoce o alguien que no conoce se enferme gravemente. Gracias por todo lo que está haciendo para luchar contra el COVID aquí en la ciudad de Long Beach. Para terminar, quiero agradecer a todos los que eligen quedarse en casa este fin de semana festivo. Cada precaución que tomamos ahora nos da la oportunidad para participar juntos en futuras celebraciones. Nuestras acciones salvan vidas y cada uno de nosotros puede hacer su parte para prevenir esa propagación de este virus. Esto es todo por hoy. Muchas gracias por acompañarnos. Feliz Año Nuevo. If you've joined during our Spanish translation, please visit our Facebook to see our press briefing from the beginning with Mayor Garcia and Dr. Davis. That is all for today. We wish you a Happy New Year. Thank you for joining us.